Actually, Miss Anis, based on the observation, your wood hasn't healed yet. It appears that there is still some blood clotting, which is hindering the healing process. So I think it may take a few weeks to recover.
So doctor, is there any way to speed up the recovery time?
Actually, there is a new treatment that is involving using argyrodin from each saliva.
So could you explain how this process works? What you have seen just now is the function of leeches. So, let me tell you about the leeches as Hirudin. Leeches are fascinating organisms with diverse characteristics and important roles in both medical and ecological contexts. Hirudin is a naturally occurring anticoagulant produced by leeches, specifically found in their saliva. Do you guys know the function of Hirudin? So, let me tell you. Function of Hirudin is a potent anticoagulant that prevents blood clots and treats thrombosis. It also has potential benefits in wound healing, anti-tumor effects, and anti-pulmonary fibrosis.
Here's the medical application of Hirudin. Firstly, it is post-surgical healing. Hirudin is used in surgeries, especially in microsurgeries like reattachment of limb or tissue graft. It is used to prevent blood clotting and ensure continuous blood flow to the affected area. Secondly, thrombosis treatment. Since Hirudin is a strong anticoagulant, it has been used in the treatment of deep vein thrombosis (DVT) and other clotting disorder. And for the last one, improving blood flow. In conditions where blood flow is compromised, such as after reconstructive surgeries or treatment of venous disorder, Hirudin promotes better circulation by preventing clot formation and ensuring the area remains well oxygenated.
There are many advantages of Hirudin. Firstly, anticoagulant properties. Hirudin prevents blood clotting, ensuring continuous blood flow in reattached tissues and enhancing the success rate of surgeries. Secondly, blood flow improvement. Leeches facilitate the removal of venous blood congestion, promoting faster healing and tissue survival. Next, reduce complications. The use of leeches can prevent tissue necrosis and reduce the risk of failed surgical outcomes. Last but not least, treatment of chronic disease. Hirudin's anticoagulant properties make it beneficial in treating chronic vascular disease, such as deep vein thrombosis, where blood flow needs to be improved in specific body parts.
Yes?
So Safira, how to get our Hirudin from leech saliva?
Do you want to know about it? Let me show you guys. So, for step 1, collection of crude Hirudin product from leech saliva. First, the leeches are placed into the container and ensure that they are fully stocked. Next, the leeches is added into the inductive substance to encourage them to absorb it completely. So, this is the composition of the inductive substance. Next, after the leeches have absorbed the inductive substance, the emetic is added to induce them to expel the saliva and crude Hirudin product. And this is the composition of the emetic. So, last for the step 1 is the crude Hirudin product, which is saliva and Hirudin, is collected in the container. The product is placed in the refrigerator to freeze and preserve from later steps. Then, leeches are removed from the container, rinse them thoroughly, and return them to the rearing pool for continued growth. Next, step 2, purification of crude Hirudin product. The collected Hirudin product is stored 250 to 300 milliliter of the product is measured out and is added into cold acetone containing 15% water, which is 4 times the volume of the crude product. Then, the mixture is placed in a refrigerator pre-cooled to 4 Celsius. Stir and leave overnight at the same temperature to allow precipitates to form. Following that, the suction is used to remove the acetone supernatant and perform centrifugation. 20 to 30 ml of pre-cooled trichloroacetic acid is added to the precipitate to dissolve it. Centrifugation is performed to remove any remaining residues, resulting in a concentrated salivary gland secretion solution. So, for the last step, which is step 3, final purification and product isolation. Gel filtration chromatography is performed on the solution obtained from the anion exchange process to yield the final R-hirudin product. And last but not least, use an anion exchange column to purify the concentrated salivary gland secretion solution.
In conclusion, leeches, often overlooked, produce hirudin, a powerful anticoagulant in their saliva. This natural compound has various medical uses, including aiding post-surgical healing and also treating thrombosis. The extraction of R-hirudin from leeches shows the importance of harnessing nature's resources for medical advancement.